When an elderly loved one begins to change, losing weight, sleeping more, or seeming withdrawn, it's easy to brush it off as just aging. But sometimes, these subtle shifts are the body's quiet way of preparing for its final chapter. In this video, we'll explore 5 important signs that may indicate someone is nearing the last year of life. Recognizing these changes early doesn't mean giving up. It means understanding what's happening so you can offer better care, deeper comfort, and more meaningful moments together. If you're supporting an aging parent or grandparent, this is information you don't want to miss. Sign 1. Significant weight loss. One of the earliest and most overlooked signs that a loved one may be entering the final year of life is unintentional weight loss. It doesn't usually happen all at once. It begins subtly. Perhaps their clothes seem looser, their face appears thinner, or they start skipping meals more often. Many families chalk this up to aging or simply a poor appetite, but the truth is, this can be the body's first quiet signal that something deeper is happening. As we age, our metabolism naturally slows, but when weight loss is rapid or continues without effort, it may indicate that the body is no longer processing food and nutrients effectively. Muscles begin to shrink, fat stores deplete, and strength gradually fades. This muscle loss, called sarcopenia, doesn't just make someone appear frail, it puts them at higher risk for falls, weakens the immune system, and impacts nearly every system in the body. Loss of appetite is another major contributor. Food often stops tasting good. Sense of smell may fade. Nausea or digestive discomfort can increase. But more importantly, the body may stop asking for food altogether. This isn't a matter of stubbornness, it's a biological response to the body slowing down. When someone who once enjoyed meals now eats just a few bites or pushes food around the plate, it's time to take notice. Sometimes, underlying conditions like cancer, kidney failure, or advanced heart disease can be the cause of unexplained weight loss, illnesses that progress silently in older adults. Mental health also plays a role. Depression and cognitive decline can suppress appetite and create disinterest in eating altogether. Families often respond by urging their loved one to eat more, preparing favorite dishes, or trying nutritional drinks. But when the weight keeps dropping despite these efforts, it's not just about diet, it's a sign that the body may be transitioning. At this point, the goal should shift from trying to reverse the weight loss to preserving comfort and dignity. Easy-to-eat foods, snacks they enjoy, and staying hydrated can make a bigger difference than forcing full meals. What matters most is quality of life, not calorie counts. If you've noticed unintentional weight loss in an elderly loved one, don't dismiss it. This may be the body's way of sending a message. Recognizing it for what it is can help you adjust expectations, offer gentler support, and focus on making the time ahead as meaningful and comfortable as possible. Sign 2. Extreme fatigue and withdrawal. Another subtle but powerful indicator that someone may be entering the final year of life is persistent, extreme fatigue, both physical and emotional. This isn't the kind of tiredness that goes away with a good night's sleep. It's a deep, ongoing exhaustion that doesn't improve, no matter how much rest the person gets. You might start to notice that your loved one is sleeping longer at night and taking more naps during the day. They may struggle to stay awake during conversations, meals, or favorite activities. Things that once brought them joy, gardening, reading, watching their favorite shows, may suddenly seem like too much effort. Their energy is no longer just low, it's nearly gone. This kind of fatigue is the body's way of conserving energy. As internal systems begin to slow down and organs work less efficiently, the body naturally redirects energy toward essential functions. Even the smallest tasks, like getting dressed or walking to the bathroom, can feel overwhelming. Some individuals may start to spend most of their time in bed or a recliner, and when they do move, it's at a slower pace, often with the help of others. But this change isn't only physical. Emotional and social withdrawal often accompany the fatigue. A person may talk less, stop initiating conversations, or seem disinterested in visitors. They may avoid phone calls, social events, or even family meals. At first, it might seem like they're just having a quiet day or feeling a bit down, but when it becomes a pattern, it's often a sign that their world is getting smaller. This withdrawal isn't necessarily depression, although the two can look similar. Instead, it may be the mind and spirit gradually detaching from the external world. For some, it's a form of preparation, pulling inward to reflect, rest, or simply let go. For loved ones, this can be painful to watch. It's hard not to take it personally when someone no longer wants to talk or be around others. But it's important to understand, they're not rejecting you, They're responding to changes they can feel but may not be able to explain. The most compassionate response is to meet them where they are. Sit quietly beside them. Offer presence without pressure. Even a gentle touch or a few peaceful minutes together can be deeply comforting. Extreme fatigue and withdrawal are not signs of giving up. They are signs that the body and spirit are shifting. And in this phase, what matters most is peace, presence, and unconditional love. Sign 3. Cognitive decline and confusion. Cognitive decline is another significant sign that the body and mind may be preparing for the final stage of life. This doesn't necessarily happen overnight, and it can begin subtly. You may notice your loved one becoming more forgetful, misplacing items more frequently, repeating questions, or struggling to find the right words during conversation. While occasional forgetfulness can be part of normal aging, consistent and noticeable changes in memory and thinking often signal something deeper. As this progresses, confusion can set in. They might forget the day or time, or become disoriented in places that were once familiar, like their own home. Some may not recognize familiar faces right away, or they might mix up names and relationships. This can be incredibly hard for family members to witness. Seeing a parent or spouse unsure of who you are can be heartbreaking, but it's important to remember, it's not intentional. Their mind is simply changing in ways that are beyond their control. Emotional shifts often accompany cognitive decline. A once calm person might become irritable, anxious, or paranoid. Some may express fears that others are stealing from them or plotting against them, not because they genuinely believe it, but because their brain is trying to make sense of things that no longer feel right. Hallucinations can occur too, seeing or hearing things that aren't there. These changes can be unsettling, but they're common when the brain begins to lose its ability to process the world clearly. Another thing to look for is a lack of engagement. They may seem less interested in conversations or less responsive to their environment. They might stare into space for long periods or appear distant, even when others are present. It's as if the outside world becomes harder to connect with, and they begin turning inward. For caregivers and family members, this stage calls for deep patience and compassion. Correcting them repeatedly or insisting on facts can cause frustration. Instead, try to meet them where they are. If they believe something that isn't accurate but it's not causing harm, it's okay to gently go along with it. The goal is not to force reality, but to preserve their sense of safety and comfort. In this phase, it's more important to offer calm reassurance than logical explanations. Soft tones, familiar music, and a peaceful environment can go a long way. While they may not always remember your name, they can still feel your love, and that's what stays with them, even as words and memories fade. Sign 4. Frequent infections and slow healing. As the body nears the end of life, one of the clearest physical changes is a weakening immune system. You might start noticing that your loved one, who rarely got sick in the past, now seems to catch every cold, flu, or minor infection that goes around. What once would have been a small health hiccup now takes much longer to recover from, or doesn't fully resolve at all. One common sign is repeated infections, such as urinary tract infections, UTIs, pneumonia, skin infections, or even oral infections. These may begin to occur more frequently and require longer or stronger treatments to manage. In some cases, antibiotics that used to work quickly no longer seem as effective, and the person may need multiple rounds of medication. Families often see these episodes as isolated illnesses, but when infections become routine and recovery is slow, it's a strong indication that the body is struggling to fight back. Wound healing also becomes noticeably slower. Something as minor as a small cut, scratch, or bruise may take weeks to heal, or may reopen easily. Poor circulation, another sign of the body winding down, means that oxygen and essential nutrients aren't reaching the skin and tissues efficiently. This slows the healing process and increases the risk of chronic wounds, including pressure sores, especially in those who are less mobile. Perhaps even more concerning is that infections in older adults often don't present in typical ways. Rather than running a high fever or showing obvious symptoms, they might just seem more tired, withdrawn, or confused. For seniors, a sudden dip in mental clarity is often the first warning sign of an infection. This is why it's important not to dismiss these subtle changes. They could be the body's quiet call for help. In this stage, the goal often shifts from curing the illness to providing comfort. Keeping the skin clean and moisturized, staying hydrated, and reducing stress on the body may do more for their well-being than another trip to the hospital. Gentle care and emotional support can go a long way in making them feel safe and at ease. Frequent infections and slow healing are not just medical issues, they're signals that the body is preparing to let go. Recognizing this allows families to respond with grace, compassion, and the kind of care that truly matters most at the end of life. Sign 5. Major changes in breathing or circulation. One of the most profound signs that the body is nearing its final stage is a noticeable shift in breathing and circulation. These changes can appear gradually or seem to come on suddenly, but they're often the body's way of conserving energy and prioritizing essential functions as it begins to slow down. You may notice that your loved one starts breathing more slowly or shallowly than usual. Sometimes their breathing becomes irregular, fast one moment, then followed by a long pause. One specific pattern, called Cheyne-Stokes respiration, involves cycles of deep, rapid breaths followed by moments where breathing nearly stops. While it can be unsettling to witness, this rhythm is common in the final months or weeks of life and doesn't necessarily mean the person is in pain. Along with changes in breathing, circulation also begins to decline. The hands, feet, ears, and nose may start to feel cold to the touch. The skin may look pale, bluish, or mottled, particularly on the fingers and toes. This happens because the heart is no longer pumping as strongly, and the body shifts blood flow away from the extremities to focus on vital organs. Many people also experience shortness of breath with even minimal activity. Things as simple as sitting up, speaking, or shifting position can leave them winded. You may notice more frequent mouth breathing or longer pauses during conversation. If they once could walk across the room with ease but now struggle with basic movements, this could indicate declining lung function. In some cases, fluid begins to build up in the lungs, leading to a persistent cough, a gurgling sound when breathing, or a sense of chest tightness. These symptoms might resemble a common cold or mild congestion, but in older adults near the end of life, they often signal that the lungs are weakening. This can make lying flat uncomfortable, and many people prefer sleeping upright to breathe more easily. For families, these changes are understandably distressing. There's often a natural urge to fix the problem, encouraging deeper breaths or worrying that something urgent is happening. But more often than not, these are signs of the body gently letting go. Comfort becomes the priority. A cool room, a humidifier, or small sips of water can ease discomfort. In some cases, oxygen therapy or medication may help, but the goal shifts toward peace rather than intervention. Recognizing these signs gives you the opportunity to be present, not with panic, but with quiet support and love. It's a time to focus on dignity, reassurance, and creating a peaceful space for your loved one to rest. As we come to the end of this video, take a moment to reflect on what we've shared. These signs, significant weight loss, extreme fatigue, cognitive decline, frequent infections, and changes in breathing and circulation, can be difficult to witness, but they are often the body's natural way of preparing for its final transition. Understanding them can help you respond with greater compassion, patience, and peace. If someone you love is showing these signs, know that you are not alone. This journey is deeply personal, but it's also one many families walk through with strength and grace. If you found this video helpful, please consider subscribing and turning on the notification bell so you don't miss future content. Leave a comment below and let us know which part resonated most with you. We read every message. And if you think this video could help someone else, please share it. Your support truly makes a difference.